And I'm Dr. Davendranand Sharma. I'm trained in psychiatry from the University of West Indies, and back in Guyana now after nearly 20 years with offshore U.S. Medical School, Ross University. So I'm doing mostly private practice work with two hospitals, Woodlands and Mercy Hospital. But doing my bit for my country. Good to be back home, and glad to be part of this conference. We're talking today about COVID and its effects on our health workers. So I did a presentation for CME some time ago, which was much more longer than what we're going to look at just now, and thought we could use that to introduce this afternoon discussion, because we got to do more, I think, for our health workers. Maybe I'll have a chance to say a little bit about some of the persons I'm seeing in the health sector during the presentation or during the discussion time. So that's a bit about me.
Go ahead.
Sure. Hi, I'm Moti Ramgopal. I'm infectious disease trained. I'm based out of Fort Pierce, Florida, but I also have a clinic here in part of Georgetown. I've been in infectious disease now for over 25 years, trained University of West Indies, medical school, and then residency in Detroit, Michigan, and fellowship at University of Miami. I'm in private practice as well as university affiliated. Have been dealing now with COVID since the inception, as well as general infectious disease over the last mentioned 25, 30 years.
Thank you. Yes, please
Hi,
go ahead.
Dr. Dev Prasad. I'm one of the medical registrars at the Georgetown Public Hospital. And I'll be talking more about the local perspective as it relates to mental health among frontline workers in Guyana, having been one of the doctors on the front line since the very inception of COVID in Guyana.
Thank you. And
hi, my name is Aliyah Cort. I am with the Ministry of Home Affairs, and I am a contracted worker and professional in therapy and counseling. And my area will be focused on the service provided by the force to the public as it relates to the pandemic.
I'm Alicia Solomon, social worker attached to the Ministry of Health, Mental Health Unit. And I've been with the Mental Health Unit from its onset, from the start 5 years ago. And I've been very much involved with COVID in terms of reaching out to persons who are in isolation and how helping them to cope with how getting through that period of isolation. So my conversation will be based on how we frontline workers were able to cope with those stressors of dealing with those persons who are in isolation.
okay, thank you. And after a few glitches to the start, I'm glad to welcome everyone here to our panel this afternoon. And Dr. Sharma, why don't you begin your presentation now?
Very good, thanks. Yes, so we're back on stream. That's great. So just wanted to go over quickly what's happening in terms of COVID and its effect on our health workers. But we don't really have much in terms of research in Guyana, though I know there's some research projects on stream. So we're looking forward to seeing some data from that. But just generally, I thought we could look at what really does COVID do to our health workers from studies that have been done overseas. And one of the biggest things that I found is that fear is the biggest factor. The fear of contracting the infection among ourselves, because we are so close to those who are infected. And we can see that from the worldwide studies that health workers have to cope with a lot of stress and the emotional distress because of exposure, the work, trying to combine work that the hospital and then the family. And then the other problem that I see here in my experience with our health workers at these two hospitals I'm attached to is that many of the nurses, they're scared that they would carry viruses back into the home. And so they may not even be with the children long enough. I know one nurse who's actually separated herself from the family, and that's doing her and the children very badly because one of the child that she has stopped talking. And I told her, look, you gotta go on back home and be with that child, which she did, and he started to talk again. So we see the effect on the children, on the family, on the worker themselves, because they have to, especially the moms who have to combine hospital work, because most of our nurses are ladies, and also try to manage the family and the children. So eventually people start to get burnt out, experiencing anxiety, stress, fear, sleep problems, and so on. And this study from China looked at 2,000 something nurses, found that 91% of them actually had fear as an experience with depression. And also a big study done in Pakistan showed pretty severe stress at a level of about 26% among our health workers, with moderate stress about 42%, which is also very high. You talk about half of the health workers experiencing significant stress. And as we know, the fear and depression are correlated. So we see another study here from Canada talking about another half of the healthcare workers seeking psychological support. That was just done from Journal Intensive Care. So many a times our health workers are caught up in that, trying to balance the two jobs. They're also worried that if they disclose about others that they feel might be positive, it can affect their jobs, and everybody needs the finances so much more at this time to manage home life. So there's a lot of guilt, a lot of worry. I know people try to cover up for other people. It's very difficult. So something we can look at in our discussion time. So nobody wants to come off the job. We sadly lost one of our doctors who apparently may have carried the symptoms without notifying. So we're having problems. We gotta face the facts. So support systems, I'm glad that our folks are here that are doing the work, so we can hear some of the positive news, because we get overwhelmed with the negatives that people are not there, I'm not getting the support. We don't have a support center set up. So fear is the issue, and the slides talk about the correlation of fear and depression, as you can see. PET scan showing activation of the brain, and then there's a whole series, a cascade of events that occurs. But I want to bring this slide showing that when the brain, or when we feel that we are able to have support mechanisms, the coping mechanisms are good, we don't get that stress reaction. But when the coping mechanisms are not adequate, when the brain itself is seeing it as not adequate, that's when the body becomes overwhelmed. So some solutions here as I close up this presentation is that we really need to have those formal support centers set up where people can come in and have the privacy, they're able to be confidentially managed. I do manage many of our health workers, and I've seen some very difficult cases. One actual staff member was very aggressive, I think had some neurological effects, and was very angry and very upset when was asked to not come to work. So he became even belligerent, so reactions are not good. So you need a support place, a crisis counseling center, you need time out, you need people to be able to get some time off work when they're feeling overwhelmed. You need them to be able to connect to their families, be able to access support system. I would know our cell phone companies have been providing support like that, and that's very, very creditable to them that they can actually have our health workers be able to have free cell phone use. So that's good. Mental health professionals, and we have some here, and I would like very much at this point to hear from the others as to what's going on and what they're doing So thank you very much. A very short presentation just to bring us to the reality of what we're dealing with, especially the fear that many people experience and still experience. Thank you.